everyone, and thank you so much for joining us tonight for this special Just for Kids presentation. I'm Kylie McGivern, and tonight we're going to talk about something that is having a staggering effect on our local birthing units, and that's neonatal abstinence syndrome, or in other words, babies being born addicted to drugs. Regionally, the NAS rates are extremely high numbers, published by the Tennessee Department of Health, and those numbers show that the NAS rate in Northeast Tennessee is almost 4 times higher than the state average. So why is the rate so high in our region, and what can be done about it? We hope to answer those questions and more tonight. You can call with your questions. The number to call is 1-888-903-9545, and we'll answer as many as we can in the next hour. And I'd like to take a minute now to introduce our panel of health experts. We have Dr. Mike DeVoe. Thank you so much for joining us. We have Dr. Cynthia Thomas and also a registered nurse, Krista Hatley. Thank you all so much for joining us tonight. Now, this is a topic that some obviously know a lot more about than others, but I want to go around and find out what your all specialty is and how you work with this problem that is so intricate. We'll start with you, Krista.
I'm the nurse manager of the NICU at Niswonger Children's Hospital. So I help the nurses care for these babies with NAS.
And how long have you done that for?
For going on 9 years.
Going on 9 years, great. And what about you?
I'm Dr. Mike DeVoe. I am the chairman of the pediatrics department at ETSU and also director of the NICU at Niswonger Children's Hospital, and I'm on the State Perinatal Commission.
All right, thank you so much. And what about you, Dr. Thomas?
I'm a preventive medicine physician. I'm employed by the Tennessee Department of Health and based in the Northeast Tennessee Regional Health Office here in Johnson City. And I'm tasked with developing and implementing primary prevention initiatives in our region.
We have quite a scope here. Well, thank you all so much again for joining us. Now, we'll start with you, Dr. Thomas. If you could explain to people sitting at home who may not completely realize what NAS is, or neonatal abstinence syndrome.
Neonatal Abstinence Syndrome, or NAS, refers to a group of signs and symptoms that may be exhibited in an infant who is withdrawing from drug dependency following delivery.
And Dr. DeVoe, you had brought basically a checklist of things that you all go through that seemed very extensive, and you wanted to point out one thing about that list. What was that?
One of the items I brought to the station here tonight was a list of an order set that we use to treat these babies who have neonatal abstinence syndrome. Okay. And I think a common misconception that the general public has is if we have to treat these kids, it's all about us just giving them medicine on top of medicine on top of medicine to treat the symptoms. But there are probably 40 different items on that order set, but only 2 or 3 of those are related to giving medication. The rest of the order set really consists of things like that we teach the parents how they can keep the kids from being irritable, how to hold them, how to not disturb them, how to give them their rest time, how to coordinate feedings, when to change diapers, how to go ahead and just plan for taking the babies home. And we have flip card education systems and involve physical therapy, sometimes speech therapy for treatment of these kids. So it's not just all about medication treatment.
And it sounds like there's a lot of teaching that goes into your involvement with these parents once these babies leave your care, huh?
Well, I know it's a cliche, but really hospital discharge starts with admission. And that's especially true for these kids that are in the hospital for an average of 17 or 18 days once we start them on replacement medication. So we really do start from day one educating the parents and working with them, and then working with the local agencies to make sure we can safely send these kids back to a good environment.
Absolutely. And now, Krista, some people may be a little bit confused of how NAS compares to fetal alcohol syndrome. How would you describe that difference there?
So with NAS, typically symptoms will start either right away. They can start also as late as 3 days or even 5 days, where fetal alcohol syndrome, you do not see symptoms like that. Typically those patients will go home and they'll have long-term effects. Unfortunately, we do not know the long-term effects of NAS right now, but they are symptomatic almost immediately.
And since we don't know those long-term effects right now, do you or any of you all know any research that's being done to look into that and gauge that later in life?
Well, I guess it's funny you should mention that. But ETSU, through the School of Public Health, has an existing grant to look at addictive behavior in general in the Appalachian region, and there is a co-grant being sponsored, again, through School of Public Health, to set up a long-term follow-up program specifically for these neonatal abstinence syndrome infants that we're discharging home, because there is no good information anywhere right now on how these kids do 2, 3, 4 years from now. And our big concern is what impact are these kids who are at very high risk for developmental problems and learning problems. When they hit the school systems in a few years, we have to be able to provide the school systems the right information to be able to gear up to handle specific needs that these kids may have.
And it sounds like that can be incredibly beneficial, because I know even some of the mothers and caregivers for parents that I've spoken with who have children that were born with NAS, it sounds like any things that come up later in life in education or any struggles, they always have that thought of, is this related to NAS, or is this something completely different? Am I thinking too much of this? So it sounds like that's exactly what it's looking to address, and so would work with the school system, it sounds like. Wonderful. And now, what drugs cause NAS? When people are thinking about, okay, what may lead to this, I'm sure it's a broad spectrum, but can you all address some of those things?
I think the most common medications that we get reported that mothers are taking that cause the symptoms are primarily Suboxone, Subutex, and Methadone. Those are probably the primary three, and I would probably say over 90% of our babies admitted to our NICU and needing the special care have one of those three medications present.
And one of the things that I know is ironic and scary for some mothers with that is a lot of times they're taking these medications to thinking that their baby will not have withdrawal symptoms because of that. So what complexities does that add when you have a mother who's saying, I didn't know, I was told this wouldn't happen, and that's what's putting them in this situation? I mean, I know we could go into this a lot, but how do you address that with these mothers?
Well, the mothers are expressing, number one, guilt. I did something during the pregnancy that my baby now has symptoms. The mothers then express anger frequently at the prescribers of the medications. And Dr. Thomas and the health department, I know, are working a lot with the prescribers to make sure that they clearly outline the risk to the infant if the moms are on these specific types of medications during pregnancy. The state of Tennessee was instrumental in getting what's called a black box warning, which is a big warning that's very visible on the package inserts for all these pain medications. That's been implemented nationwide now, that says to the prescriber that you have to counsel your moms to make sure that they are aware that this is a potential. And along with this counseling to the prescribing clinics now are also emphasizing birth control or interconception care to try to decrease the number of infants that are exposed through moms being on these substances while pregnant.
So it sounds like this is an educational issue that needs to be addressed from the level of the prescribers down to the patient, and not talking down on the patient, but just when you think to trust somebody with all this education, it sounds like that may not be there in some situations.
Well, and if I could comment on that, Kylie.
Of course, please do.
I think that it's important, and we've talked about this as professionals working in this area, that having consistent messaging about the potential for withdrawal following drug dependency in utero is so important. So that all of providers have accurate, up-to-date information to provide to patients about the risks and benefits of medications that they're on or substances they're exposed to, so that they have real ideas and they're very educated about what the potential risks are.
Because it sounds to me, I mean, correct me if I'm wrong, that it could be a gamble depending on what provider you go to or who's telling you what advice, depending on the outcome. I mean, I would think that that would be very scary for a lot of parents, wondering who has that correct information and who has that knowledge.
And if I might interject,
Yes.
we're not implying that moms don't need to be on pain medication during pregnancy. I mean, pain is a true, real thing that does require prompt and proper treatment under good supervision. So I'm not telling all the moms who are on pain medications to go ahead and stop this automatically, but it has to be done the right way.
And while we're on that, what are some of the biggest misconceptions that you all deal with? I know you wanted to just clarify that right there. Any other points that seem to come up a lot that you want to address to each of you?
Well, I would say that there are misconceptions about the mothers to whom this is happening, whose infants are being born with a dependency and then withdrawing, and it's important.
The population.
It's important to note that the majority of these women have a prescription for the medicine that they are taking during pregnancy, and there are a variety of indications for those medications. And so it's not necessarily that women who are having babies born with drug dependency are taking illicit drugs or are taking diverted drugs. Most of them do have a prescription and are taking the prescribed medication appropriately in many instances. And so I think it's important to remember that we can't make assumptions about what has led to the drug dependency in the baby.
Anything that you all want to add to that?
the word needs to get out that your baby has a potential to be admitted to the NICU, and although it can be sad and scary and frustrating, we are there to help. And
the alternative would be worse than getting with someone and getting that care.
Yes.
Well, thank you guys so much. We're going to take a quick break, but on that point, that's a great jumping off point. We don't want there to be any fear about asking these types of questions, so know that our lines are open right now, and we'll be right back after this.
Niswonger Children's Hospital, just for kids.
Our region is seeing a drastic increase in babies born exposed to drugs. When a pregnant woman takes certain drugs, prescribed or illegally, her unborn baby can develop drug dependency. Babies born dependent on drugs can experience a variety of withdrawal symptoms known as Neonatal Abstinence Syndrome. Niswonger Children's Hospital and WJHL Just for Kids urge you to call or visit the web to find out more about Neonatal Abstinence Syndrome.
Just for kids, because one size doesn't fit all.
Hi, I'm Kylie McGivern with News Channel 11. The number of babies exposed to drugs before they are born is drastically increasing in our region. Exposure to drugs often leads to neonatal abstinence syndrome. Niswonger Children's Hospital and WJHL are working to provide hope, support, and education to drug-dependent mothers. Don't let the shame of drug addiction keep you from getting the help that you and your baby need to start a healthier life together. All you have to do is visit WJHL.com/justforkids in your corner for information.
Niswonger Children's Hospital, just for kids.
Babies withdrawing from drug dependency, also known as Neonatal Abstinence Syndrome or NAS, is a growing issue in our region. If you've used prescription opioids or street drugs, ask your healthcare provider about long-acting birth control. Prevent an unintended pregnancy and a baby who could experience NAS.
Niswonger Children's Hospital and WJHL Just for Kids urge you to call or visit the web to find out more about Neonatal Abstinence Syndrome.
Just for kids, because one size doesn't fit all.
Hi, I'm Kylie McGivern, and welcome back to our Just for Kids special, where we're addressing the questions and concerns surrounding neonatal abstinence syndrome. And I'm joined now with our expert panel here. And one of the things that we didn't address enough and didn't emphasize enough is what a problem this is, not only nationally, not only in the state, but specifically in our region. Talk to us about that.
So we know that neonatal abstinence syndrome has been a growing problem over a course of many years in the state of Tennessee, but it's very specifically a problem in Northeast Tennessee. When we look at Northeast, we're talking about Sullivan County, also Carter, Greene, Hancock, Hawkins, Johnson, Washington, and Unicoi counties. And those counties represent about 21% of cases that occur across Tennessee. But even more important is to look at the rate, which takes into consideration the underlying population and the birth rate in that population. And when we look at the rate, those 8 counties I mentioned in Northeast Tennessee have by far the highest rate in the entire state. And so it's very important that we understand that we have a very regional problem and that it very much impacts our region.
And that may be surprising to a lot of people sitting at home. I know even people I've talked with in different communities about this story say, well, our population isn't as high here. What about some of the bigger cities, Middle Tennessee, Memphis, East Tennessee, or excuse me, Far West Tennessee? Why do you think that is, that it's so much higher here? Or what are some of your thoughts as to why it may be?
It's difficult to say, and I think that's a very complex question. And I think some of the other regions of the state have differing problems of their own and may have a slightly different problem that affects infants in those regions. And NAS, unfortunately, is a very, very specific problem to our region, but it's very difficult to say the factors that are influencing that. And I think that we could talk probably for another hour just about the complexity of those factors.
And Krista, you said that you have been in your role now for about 9 years. In your time, what trends have you seen, even just working here? And have you always worked in Johnson City?
I have, and the numbers have grown significantly. When I first started working, we would maybe have 1 infant with NAS every 2 to 3 months. And now we are seeing anywhere from probably our lowest number would be about 6, and our highest number so far that we reached this summer was 15 at one time. So the trend has just really risen.
And how is that affecting the resources at the hospitals in terms of taking care of these children? Again, I feel like I'm asking all these questions that we could spend easily hours on